Hello there, my name's Ian Garlington. I'm the Better Communities Programme Director here at South West London and St George's, and I'm here to introduce you to the ongoing work we're doing around the Better Environments and Communities programmes. It's a massive programme. We're investing more than £280 million in new environments across our areas, and that's really important because through co-production with you, we're not only developing Springfield Hospital, which is where I am today, but also Barnes Hospital, Richmond Royal Hospital, and now Tolworth Hospital is also in the throes of redevelopment. It's exciting stuff because as we open up our sites and we start to work through what all of those things mean, we start to create a new culture within our organisation. The spaces between our buildings is where those things live. It's where we actually start to meet each other, where our patients interact and where we interact with our communities. And importantly, it's really key to us breaking down the stigma against mental illness, and also where we are actively anti-racist in pursuit of some of our key trust challenges. Let's have a look at more of the programme as we go through. This began at Springfield Hospital, where we've invested to develop the new Trinity and Shaftesbury buildings, providing first-class facilities for our services. Space, light and nature were our guiding principles in developing the buildings, which were shaped through over 400 consultations with our staff, our patients and our wider community. Trinity and Shaftesbury now house 8 wards, as well as adult and community services, our recovery college, teams supporting children and young people, and a full range of specialist services including forensic services, eating disorder services and the National Deaf Services.
There's been a lot of changes, a lot of work that's been done since 2020, but I've seen the changes that it's made to the environment and the benefits it's having to the young people and the patients that we serve here. Our CAM services here, we assess children and young people that have been referred by their GP, and once we've done our assessment, we're thinking about a treatment plan and interventions for them. So often when we're working with our young people, we invite them into our clinics, and it's really crucial that they come into an environment that is welcoming, non-threatening and feels quite safe, and the new environment creates that for them.
Artists from mental health charity Hospital Rooms created 20 world-class artworks inspired by over 120 workshops they hosted with our patients and our staff over 3 years working with our trust. These feature throughout our facilities and wards, helping to create a new canvas for modern mental health care. Beyond our buildings, our new community at Springfield, Springfield Village, is going a step further in creating an inclusive new landscape around our trust headquarters, with a new public square, shops, hundreds of new homes and a new 32-acre park. Within the park, you'll find features like the Pavilion Cafe, sensory gardens, ponds, play areas, a trim trail and spaces for informal sport and activity. This is transforming our site from a Victorian-era estate into a vibrant community and a new cultural destination supporting health and well-being of our local population.
I've worked at Springfield for just about over 20 years. I remember the days when I started when it was walls, fences and completely separated from the community. Buildings are 100 years old. If you look at it now, state-of-the-art buildings that we have around, much closer to the community, becoming more of a village. The attitude towards mental health has certainly come a long way since then.
We are thrilled to be creating this brand new community, but this is only half of our story. Works are ongoing to redevelop the former Richmond Royal Hospital. This will open as a base for our young people's outpatients teams during 2025. Works are also underway to transform our hospital at Barnes for delivery to services in 2026. Together, they represent a further £15 million investment in our services across South West London.
We're really excited to be opening the Richmond Royal Health Centre for our young people and children. There's loads of history here and heritage, and even though we're not a hospital anymore, we're really excited that NHS will still have a presence on site. Work's nearly finished, then we have the fit out, and then we'll start familiarisation with the teams. The team are currently based in Livingston House in Teddington. When we finish the works here, the team will be moving in here in early 2025.
We're proud to be supporting the LHS, building a new outpatient centre here at the old Barnes Hospital site. This will provide a modern facility for mental health services in Richmond and will be part part of a new mixed-use community alongside a new special educational needs school and new residential housing. Our teams here at Barnes will be working closely with the partners and neighbours as we breathe new life into the site with delivery of the Trust's new facility on course for 2026.
Tolworth Hospital is the final part of our Better Environments programme. Pending final government approval, we plan to invest £110 million to rebuild Tolworth, again creating first-class facilities and opening up the site to our community and access routes across a central plaza and a community cafe. This will complete our vision to create 2 stigma-breaking centres of excellence for inpatient care, supporting generations of people who will rely on our services in their time of need.
So we're here at Tolworth Hospital, which is a site that's been needed development for a number of years. So buildings such as the one behind me, Cedars, has been derelict for a very long time. So we're now in the process of demolishing these buildings in preparation for developing our new hospital, which will open here in 2027. So the fantastic thing about these new facilities is that it will dramatically improve our inpatient offering to our local community here, and it will also continue to offer a lot of the things that Tolworth provides to our carers as well, such as restaurant facilities. So this is a great new opportunity for all of our local service users and carers.
I hope you've enjoyed that short canter through the overall programme and some of the things you've seen, reminding you what's happening and maybe on some of the places you don't normally go. The programme's a once-in-a-generation opportunity for the future of our healthcare facilities across the 5 boroughs that we serve in South West London and beyond. But more importantly than that, think about us as an anchor institution and how we actually support the communities that we work and thrive within. We've facilitated more than £1 billion worth of commercial activity across South West London during the years of the programme, and we'll continue to do so up until 2027 as we continue down at Tolworth. It's really important because part of making life better together, our trust initiative, is to make sure that we think about how we bring prosperity to our local communities, supporting mental wellness and our preventative plans there. So I hope you've enjoyed this and I hope you engage with us more in the future. Thank you.